Hey everyone out there, hey Garden State Growing. See, for the most part, we're doing very well. But I've had some severe die-offs on some of my plants, which to me right now is just very expected. It is April 4th, 2020, Saturday. It's about the first day that I've really been able to come out to my greenhouse in over a week. I have sporadically been coming out here and throwing some water on plants with complete disregard to how healthy they are, to be honest with you. This video really isn't going to be about gardening, even though I'm going to try to motivate myself as best as I can to do something today. The reality is what we're going through here in New Jersey and in the United States. I live in Middlesex County, New Jersey. Has been devastating. It has taken an emotional toll, a physical toll, a family toll, a financial toll. I understand what everybody else out there is going through, and you have my sympathies and my condolences. You know, it's been a rough week at work. I've seen a lot of things that I never thought I would have to see in my lifetime, and I don't ever want to see again. You know, if you just take a quick look at me, I want you to ask yourself, like, what do you think this guy does for a living? You know, I've got tattoos all up my sleeves. You know, I'm kind of a rugged hobo type. I'm wearing my favorite gardening sweater, which is nothing special except for that it's just comfortable and it fits. And what do you think I do for a living? You know, like if I was standing next to you at ShopRite or some other convenience store, what would you judge me on? You know, because the reality is that I'm a surgical technologist in a hospital, and we're fighting the good fight along with some of the most incredible, beautiful people I've ever met, brave people I've ever met in my entire life. But if I was standing next to you in ShopRite and you were judging me and thinking, oh, this guy's a construction worker or a garbage man, or he works on motorcycles or cars or something like that, you'd be wrong. The reality is that I come in contact with COVID-19 on a daily basis, along with all my other coworkers. Now, I was very proud to see a lot of people wearing masks and doing, listen, I'm not judging anybody, doing whatever they have to do, wrapping scarves around their face, putting, balavakas, whatever they're called, on their faces, doing whatever they can to cover up their faces. And I was very proud, but I did see a lot of people that just had complete disregard for social distancing, for keeping their distance away from people, not wearing masks. And if you were standing next to me, you would think, oh, that's really no big deal. I don't think that he's really a high-risk person to be standing next to. And the reality is I'm probably the most dangerous person you could be standing next to. I'm watching this virus decimate communities, families, loved ones. I'm watching patients die in the hospital, drowning in their own mucus, unable to breathe. And they can't even have a loved one sitting next to them holding their hand as they pass on. for risk of they may get contaminated themselves and then spread it to somebody else. I'm here to beg the community, to beg the world, please take this seriously. Wear a mask out in public. Practice social distancing. And I'm not even talking with just everybody else out there in the world. I'm talking about with your own family. My wife and I barely interact with each other anymore. We sleep in separate rooms. My children are separated from us. We try to stay as far away from possible, because the last thing that I want to do is come home and bring this virus home and give it to one of my family members. My wife is also a healthcare worker on the front lines, and she's just as much at risk as I am. So it's taking its toll on us. But like what hit home was like this woman talking to her daughter, and they were, you know, at the deli counter, and they were just very flippant about everything that was going on. They could care less who they were standing next to or talking to or breathing on. And I wanted to speak out, and I just said, you know, if I start speaking out about everybody that I see doing something foolish, I'm going to be running around cursing and screaming at almost everybody every single day. Because even though I think that we are taking this thing seriously, I don't think that we're taking it seriously enough. So basically the frustration and the anxiety and the depression is I don't know what the right word is. It's really hard to give a fuck about anything else. You know, I would love to just come on this channel and be like, oh, here's the top 5 survival foods of right now that you can plant. Here's the quickest growing vegetables so you could live, you know. A backyard garden is great. And maybe one of this size is going to really help fortify and support this family. But not a lot of people have the capability, the knowledge, or the resources to do something of this size. Most people just want to grow like 5 plants. They want to have that great fresh tomato off the plant to put into their salad. So like for a couple months a year, they could be like, yeah, that was a great salad. You remember that? I can't wait to do it next year. Maybe I'll grow 6 plants. And that's fantastic. I commend you. But most of us, 99% of us, including me, still have to go out to supermarkets, still have to go out to stores for supplies, still have to go to box stores and hardware stores and be around each other. And how would you feel standing next to me, thinking I'm a construction worker, not knowing that 5 hours ago, I was putting a COVID-19 patient into a body bag? That's not even my job. My job is to assist surgeons during surgery. We're not doing surgeries anymore. The only thing that we're doing is taking care of sick people that are coming in truckloads and going out in body bags. We are starting to make some of the hardest decisions that we've ever had to make. Who gets to live and who gets to die? Who gets the ventilator and who doesn't? Who's too old and's not going to survive anyway, and who may we be able to save? Oh, this one's got COVID, but he's got cancer, so we're not even going to touch him anymore. Now, I'm not speaking for the healthcare system. Okay, I don't know exactly what the policies are. All I know is that our resources are not enough. They're not enough. We're New Jersey. We're the second highest state in the United States right now with cases and deaths. And I'm still watching people fuck around. I'm still watching kids go out and go to parties. And I'm not even accusing people here. I had to go to my son's job the other day and smash a mask into his chest and chastise him in front of his entire job and say, if you're going to be outside of this house, you're wearing a mask. Not just to protect him, but to protect other people from him. People see him, they see a dumb, ignorant kid. They don't know his father, okay, is a surgical tech who works in a hospital who deals with these patients every day. Okay, they don't know that his mother is a dietitian who works in a home that, an assisted living home who deals with these patients every day. They think nothing of it. I really want to scream at people and call them stupid. I want to call them ignorant. Do you really think that you're what? Brave for going out there without a mask on? That you're brave because you're bragging on Facebook how you're hanging out with a bunch of friends and having beers? Or you're brave because you're a father that's not going to let their daughter go through this like this, so you're going to take her out all the time? I hope you live through this. Because right now, the way things are looking, I've got like a 50-50 chance. I'm more than likely going to be infected. And then depending on my health, depending on the severity of the sickness, I may or may not survive. And I'm willing to take that chance. Don't ever say I signed up for this. This is not what I signed up for. I signed up to operate on people with the correct PPE to protect myself. I didn't sign up for what we're going through right now. But that doesn't mean I'm going to quit. And it doesn't mean I'm going to walk away. And even though I have days where I don't feel good and I go, shit, I think I have it. Until I get a severe fever and I'm bedridden, I'm going to keep up the fight. But what I'm not willing to do is risk my children's lives, my son Tyler and my son Tristan, or risk my wife's lives, or anybody else in our extended family, which we have not seen in months and we're not going to see in months. But the reality is my wife has a great-grandfather who's 85 years old, and he needs to be taken care of. And people have to go over there and take care of him. I'm afraid he is not going to live through this. I'm almost guaranteed he's not going to live through this. Now, I can say that because my wife and my children don't watch my channel, so that's okay, and I don't want to put fear into their eyes. But this is nothing that I haven't already talked to them about face to face. I hope, I pray I pray this ends soon. But right now there is no vaccine, there is no cure, and there's no palliative care either. If you get sick, you know what they're going to tell you? Go home, take some Tylenol. If you still have a fever in 5 days, maybe we'll have a chair in the ER to treat you. You know what that treatment's going to be? IV fluids. They don't have anything left for people. Every resource that we have is going to intensive care patients, which, by the way, our almost entire hospital has been turned into isolation wards for COVID patients. And if you think it's only the old, it's not. You know, I'm limited to what I can say because of HIPAA laws, but I'm seeing young people too on ventilators, and they're dropping like flies. Please, if you see this video, practice social distancing, practice isolation, practice good hygiene. Don't just wash your hands multiple days. Wash your hands almost up to your elbows, at least 3/4 of the way up to your elbows. Use soap and water. Perel is great. Perel is great for when you get out of ShopRite and you're going to your car, or you're getting out of your car and you're doing this, and opportunities where you don't have to wash yourself. But make sure that you do a good scrub every day for at least a couple minutes, especially before eating, after going to the bathroom. If you go out in public, wear a mask. People say, oh, it's not going to help you. It's only going to help if you're sick, not get everybody else sick. No, priority one is if you wear a mask and you are sick, yes, that is going to be the greatest thing against getting somebody else sick. But if you wear a mask yourself, right, or even a thick scarf or anything over your face is better than nothing from getting fluid or coughs or anything. You don't know, like on the news, the bus driver with a lady coughing next to her, or the hairstylist that got laid off from her job, so she decided to take clients in her basement. Okay, the chef that doesn't have a job anymore because, you know, restaurants are closed, so he's doing private lessons for people. You don't know who's standing next to you. This disease, this virus, it transmits regardless of whether someone that is standing next to you is coughing or not. I'm asking you whether you believe that this is a pandemic or not, or a stupid conspiracy theory against Trump trying to wipe out the nation, or whatever you think. I'm asking you to practice self-distancing, good hygiene, and wearing a mask so my son doesn't get infected, so his grandfather or great-grandfather doesn't get infected, so my mother doesn't get infected. I have never been more proud of what I do for a living than I do right now, even though we might not make it through this. And I say that because I have never in my life been so proud to work next to some of the most amazing, talented people with hearts so big that they find it in their heart to smile every day at work as they rush into a COVID-infected patient's room because their O2 sats are declining. Or a young girl that just gets admitted to an isolation ward and her parents weren't even allowed in the doors. But not just that, all the patients that are there that the hospitals were originally there for. Heart attacks, strokes, broken bones, minor illnesses, bumps and bruises. Everybody still needs to be taken care of. We don't have the resources to do it. Every time I see someone out in public being flippant about what's going on right now, I take it as a personal disrespect to not just me, but everybody else that I work with. We sit around and we stand in circles, feet away from each other, even though we have correct PPE on, and I'm looking at their faces saying, which one of these people are not going to be here in a couple weeks? What friend am I going to have to bury that I can't even go to their funeral? And then I see some ignorant MF joking about this and thinking it's nothing. Thank you. I love you all. But especially to my brothers and my sisters at the hospital. And it's not just the nurses. It's not just the doctors. It's the nurses' aides. It's the EVS, environmental services people. It's the people that are serving us meals, okay, at the cafeteria. It's the security that's walking around the building. It's every single person that goes to work every single day and has to deal with this and deal with people. We don't get to just sit home on our couch and bitch and moan that Facebook's getting fucking bored and you need a new video game to fucking watch. Worry that the liquor store is going to get shut down. Or you're going to get your glass of wine. Oh, boo-hoo, I got to homeschool my children. This sucks. I'm sorry, that's the last thing I wanted to do is start reprimanding people. Princeton University Hospital, Penn Medicine, I love you. I think you guys... You guys are gold. You guys are gold. And when this is over, I can't wait to give every single one of you a big hug. So I have a day off today. Shouldn't touch my face. I have a day off today, and I'm going to try to push myself through this. And I'm not going to videotape because I just want to listen to some music on my phone. And I'm going to try to plant my onions and maybe get my potatoes in the ground. I'm not going to show it. What I'm going to do is I'm just going to give you a link to other gardeners that I admire. And, excuse me. I'm just going to give you a link to other YouTubers that I admire that are much better gardeners than me. They're people that I learned everything from. So if you want to learn what I'm learning, what I'm doing, you can go to their channel and watch those videos. I'll definitely put the link in the description. And I'm just going to get going and see if I can get some things planted today. I love you. Stay healthy, stay safe, stay home.